Imagine dancing to your favorite song, and all of a sudden, you feel tightness in your chest. It feels like a deep pressure or squeezing sensation. That could be a sign of angina pectoris. So what is angina pectoris? Angina pectoris is the medical term used to describe chest pain or discomfort. This is usually due to a coronary heart disease. Angina pectoris can be manifested as chest discomfort that is described as a pressure heaviness, tightness, squeezing, burning, or choking sensation. The person having an episode of angina can be seen clutching the chest. This is called the Levine sign. Pain can also be felt in the upper central abdominal portion, the back, neck area, jaw, and shoulders. It occurs when the heart muscle doesn't get as much blood as it needs, and this usually happens because one or more of the heart's arteries, specifically the coronary arteries, are narrowed or blocked, which causes a condition called ischemia. Angina is not a disease, rather a symptom of an underlying pathology. There are 3 types of angina. We have your stable, unstable, and variant or vasospastic or Prince metal angina. Stable angina is the most common type of angina. Normally, the coronary arteries carry oxygen-rich blood into the heart through a continuous flow. Unstable angina. This is usually caused by atherosclerosis. So this is a disease in which plaques build up inside your arteries. These plaques are sticky substances made up of fat, cholesterol, calcium, and other substances found in the blood. Over time, these plaques harden and narrow your arteries. So this then limits the flow of oxygen-rich blood onto your heart. This type of angina is often triggered by physical activity or emotional stress and responds promptly to rest or to nitroglycerin. The location, duration, intensity, and of chest pain are consistent over time. Unstable angina, or also known as your crescendo angina, is an abrupt change in the intensity and frequency of symptoms, such as the onset of chest pain while at rest. It occurs suddenly and gets worse over time. This is usually caused by the bursting of a cholesterol-filled plaque in the lining of a coronary artery. These attacks may last for up to 20 to 30 minutes and can progress into a full-blown heart attack. Variant, vasospastic, or Prince metal angina. This produces symptoms similar to those of stable angina, but is caused by abnormal or involuntary coronary artery spasm, rather than directly by a build of plaque from atherosclerosis. These spasms periodically squeeze arteries shut and keep the blood from reaching the heart. This form of angina typically occurs at rest, especially in the early hours of the morning, and it frequently occurs at the same time each day. There are different factors that could trigger an onset of angina. This includes age, more than 55 years old for men and more than 65 years old for women, a history of smoking, diabetes, dyslipidemia, a family history of premature cardiovascular disease, elevated blood pressure, kidney disease, obesity, physical inactivity, and prolonged psychosocial stress. These Symptoms are precipitated by exertion or emotion stress, a full stomach or cold temperature. Pain may be accompanied by breathlessness, sweating, and nausea. Besides medications, there are things a physical therapist can address in preventing angina. Firstly, patient education. Aerobic exercises, muscle strengthening, and flexibility exercises.
Just where we've got to